Good day, everyone. I'm Kalindu Mendis from Department of Building Economics, University of Moratuwa. Today, I'm going to present you the findings of my study on the topic of policy-level consideration on marginalized communities in the post-disaster context, a death study. Apart from me, the other authors of this study are Chartered Quantity Surveyor Vijitha Disaratna, Dr. Menha Thayaparan, and Professor Yamuna Kalwarachi. So this is my presentation outline. First of all, let me give an introduction to the study. Sri Lanka has seen a substantial rise in the frequency and severity of natural disasters over the last few decades. The three common natural disasters that happen annually in Sri Lanka are floods, droughts, and landslides, which affect the lives as well as the livelihoods of so many people. When it comes to disaster management, it covers all activities, programs, as well as initiatives that may be taken before, during, or after a disaster with a view of avoiding, reducing the impact, and healing from the consequences of a disaster. So when it comes to post-disaster situation, it is a very complex and challenging situation. Yeah, the disaster-affected community experiences challenges challenges with their daily living. Also, post-disaster situations intensify social inequities, power dynamics, placing the marginalized communities at a greater risk of left behind. Therefore, the governments must ensure that those people are included in decision making, policy planning, and implementation with adequate monetary and non-monetary support and services. Moving forward to the problem statement, while the international communities has adopted the ideals of resilience and inclusion, in reality, marginalized communities are usually overlooked in the post-disaster context. In Sri Lanka, the breadth of the current community protection system is very limited in the post-disaster context, and also the existing system does not adapt adequately the real needs of marginalized communities. Further, there is a dearth of research investigating the policy frameworks related to disaster management that can support the marginalized communities in Sri Lanka. Therefore, this study intends to gather a deep understanding on the national and international policy frameworks that is required to engage marginalized communities in the post-disaster context to respond their needs and needs with the available resources. The main focus of this research is to study post-disaster context of natural disasters. Also, the women, all the people, children, and people with disabilities are considered as marginalized in the post-disaster situations. Moving forward to the research methodology, the death study and research method was selected to achieve the aim of this study. A death study is defined as the process of gathering information from existing resources such as published papers, analytical reports, policy reports, and other publications. As such, this study reviewed the policies to get insights into the policies that are related to marginalized communities in terms of their level of significance in improving inclusivity during the post-disaster context in Sri Lanka. Accordingly, this study mainly covered the policies related to marginalized communities, post-disaster management, both marginalized communities and post-disaster management, as well as general policies. Here, the policies, acts, guidelines, and frameworks are regarded and referred to as policies in the death study. To find out the relevant policies, the leading local and international organization involved in disaster management efforts as well as marginalized communities were considered. Also, key terms such as marginalized communities, inclusivity, inclusion, and post-disaster phases and post-disaster management were used in Google searches to find out relevant policies. So now let's move into the findings of this policy-based study. You know that without actively engaging marginalized communities through deliberate policies, it can significantly limit the voices of them. Therefore, it is important to have an overview on the existing global and local policies related to this subject. So we'll have a look at the carried out this study. So this study mainly focused on analyzing the links between disaster management and marginalization. Here, the policies reviewed under this study largely fall under four main categories. As such, policies that are related to marginalization were reviewed to see the mentioning about disasters, where the policies that are related to disaster management were reviewed to see the mentioning about marginalization. In addition, a few well-known policies were also reviewed to explore the mentioning either disaster or marginalization. Accordingly, 35 policies were reviewed, of which 3 are related to both disaster and marginalization concepts. 15 are related to marginalized communities. 12 are related to disaster management, and as well as 5 are general policies. So this is the findings of this study, with highlighting the key consideration of post-disaster management as well as marginalized communities. So here in this table, table shows overall analysis of the identified policies. So it can be realized that some of the marginalized community-related internationally established policies such as P18, WHO guidelines on integrated care for older people, and nationally established policies such as P16, National Policy on Disability for Sri Lanka, and P17, National Elderly Health Policy in Sri Lanka, have not considered on managing disaster situations in their policies. Some as well as some national policies related to disaster management, such as P23 Sri Lanka Disaster Management Act, P26 National Adaptation Plan for Climate Change Impacts in Sri Lanka 2016 to 2025, and P29 Roadmap for Disaster Risk Management in Sri Lanka. Those policies have not considered the inclusion of marginalized communities in their policies. It is further revealed that both global and local policies have not paid much attention to the intersectionalities in the post-disaster context. Considering all these facts, refinements of the policies in the Sri Lankan context is essential. Also, it is revealed that national policy on disaster management, the National Disaster Management Plan, as well as Sri Lanka Comprehensive Disaster Management Program, are mainly based on the HIGO framework for action, which was developed with targeting only for 25 to 2015 period. Therefore, these documents need to adopt the vision of the Sendai framework, the Paris agreements, and the sustainable development goals. And of course, all effective policies utilized in the global context can be referred to as a good practice in order to improve the inclusivity of marginalized communities in the post-disaster context in Sri Lanka. So moving to the conclusions and way forward, it has become abundantly evident that disasters have a disproportionate impact on affected communities, with the most marginalized often suffering the brunt of the consequences. As a result, it is vital to explicitly consider these marginalized communities in the policy formulation in order to manage the post-disaster situations effectively. Given the foregoing realities, policy refinements in order to improve the inclusivity of marginalized communities in the post-disaster context in Sri Lanka is crucial. Moreover, while there are policies that address marginalized communities to some extent in the disaster management context in Sri Lanka, it is clear that there are gaps in policy implementation since there is an exclusion of marginalized communities in the post-disaster situation in currently in Sri Lankan context. As a result, it is crucial to investigate the degree of execution of these policies. As a way forward, the level of implementation and barriers to implementing these policies and frameworks related to disaster management and marginalized communities will be thoroughly assessed using primary data collection as the next phase of this study. So these are the references, and this is the end of my presentation. Thank you.